Доброго дня, шановні колеги.
Good afternoon, dear colleagues. We continue our work in Ukrainian Crisis Media Center. Now we will talk about the UN mission, monitoring mission of human rights, and its report about the COVID influence on human rights in Ukraine. Ms. Bogner, thank you.
Ladies and gentlemen, on behalf of the United Nations Human Rights Monitoring Mission in Ukraine, I would like to welcome those present here and those joining us online. Today, we are launching a thematic report on the impact of COVID-19 on human rights in Ukraine. It is the first such report published by OHCHR globally. The report covers the period from the 20th of February to the 6th of December 2020. During the pandemic, OHCHR remained fully operational, putting in place all necessary measures to prevent the spread of the virus, carrying out activities in person only when possible to do so safely, and remotely when there was no alternative. The report pays particular attention to the impact of COVID-19 on economic and social rights, with an emphasis on those at risk of being left behind. It highlights how the pandemic has affected the rights of groups in vulnerable situations and exacerbated the discrimination and exclusion already faced by many of them before the pandemic. The report provides an overview of the impact of the pandemic on key human rights issues. However, further human rights concerns are expected to emerge as the number of infections in Ukraine continues to rise and the impact of the pandemic is constantly evolving. The report aims to highlight the concerns of people in Ukraine while making recommendations to those responsible for upholding their human rights, as well as the international community. We hope that this report will contribute to the global efforts of the United Nations to help member states build back better from the COVID-19 pandemic. The COVID-19 pandemic has exacerbated the hardships and deprivations faced by the conflict-affected population in eastern Ukraine and in occupied Crimea, in particular because of the restrictions on freedom of movement and their impact on the enjoyment of social and economic rights. The monthly average number of crossings through the contact line in eastern Ukraine decreased from around 1.1 million in 2019 to less than 300 as a consequence of the closure of all 5 entry-exit crossing points from late March to late June 2020. The restrictions on freedom of movement have resulted in the separation of thousands of people from their families and the loss of access to healthcare, education, pensions, and other sources of livelihoods. Women and older persons, who comprise the majority of those crossing before the COVID-19 lockdown, are particularly affected. Although crossings of the contact line have increased since June, their levels remain low, especially in the Donetsk region, due to the restrictions. In relation to the Autonomous Republic of Crimea and the city of Sevastopol, Ukraine, temporarily occupied by the Russian Federation, we see that restrictions on freedom of movement introduced by the governments of Ukraine and the Russian Federation resulted in a decrease of almost 90% in the numbers of crossings in both directions through the administrative boundary line during the period of March to September 2020, in comparison with the same period in 2019. These restrictions have affected people's access to work, education, healthcare, property, and family links. While some restrictions may pursue legitimate objectives, when persons need to cross on humanitarian grounds, all parties must ensure that freedom of movement is respected and that crossings of the contact line and the ABL are quick, safe, and dignified. The situation in places of detention remained particularly precarious, given the many detention facilities are overcrowded and are not fully able to comply with prevention measures such as physical distancing and provision of personal protective equipment. In government-controlled territory, we are concerned that the number of cases amongst penitentiary staff grew exponentially in October and November, as this places detainees and prisoners' health at heightened risk of infection. In territory controlled by the self-proclaimed Donetsk People's Republic and self-proclaimed Lugansk People's Republic, and in Crimea, no reliable figures regarding COVID-19 cases in detention are available. However, OHCHR has received information that people in detention have lacked personal protective equipment and access to adequate health care. All those in detention must be provided with testing and the medical care that they require. Early release programs should be adopted, prioritizing older persons or those who are particularly vulnerable to COVID-19. Access to justice and the right to a public trial are also affected by COVID-19 related restrictions. Some courts prohibited observers and journalists access to premises. Measures introduced to ensure the safety of court premises and prevent the spread of COVID-19 must remain exceptional, temporary, and accompanied by appropriate safeguards to protect the right to a fair and public hearing. The government should also ensure the right to a public trial, enabling journalists and monitors to be present in the courtroom when safe distancing and other measures preventing the spread of COVID-19 can be observed. Authorities should continue to develop digital tools that allow for the administration of justice remotely and take steps to minimize delays in trials caused by the pandemic. OHCHR is concerned about acts of violence, incidents of hate speech, and discriminatory acts towards different groups, including persons potentially infected by the virus, LGBTI, Roma, homeless persons, and healthcare workers as a direct or indirect consequence of the pandemic. In a number of instances, public authorities were themselves responsible for hate speech and discriminatory acts in clear breach of their human rights obligations. The systematic neglect of persons living in homelessness during the COVID-19 crisis, including the insufficient number of shelters and the lack of protection by law enforcement authorities, contributed to the phenomenon of violence against homeless people. Homeless women were particularly vulnerable to discrimination, including sexual and gender-based violence. Women and girls, particularly those who belong to marginalized groups, have been disproportionately affected by the pandemic, including due to an increase in unpaid care work, reduced access to employment compared to men, and persisting gender discrimination in the workplace. Women, including women human rights defenders, reported to us increased caregiving responsibilities and reduced salaries due to transfer to online work. The number of reports of domestic violence cases, overwhelmingly against women, has also increased during the pandemic. The government has the duty to ensure social protection to those at risk, especially during periods of crisis. The government's changes to social support for single parents therefore raises particular concerns. The changes have stopped payments of social assistance to many single parents, 93% of whom are women, who were receiving this assistance prior to the change and are now unable to fulfill new and additional criteria. This has been a retrogressive step that likely violates Ukraine's obligations under the International Covenant on Economic, Social, and Cultural Rights. Groups in vulnerable situations, and particularly women and girls within these groups, include Roma, persons with disabilities, and older persons, in particular those living in long-term care facilities and persons living in homelessness. In the context of the pandemic, it is crucial that the government removes existing barriers and combats discrimination in order to allow all groups in vulnerable situations to access health centres, including COVID-19 testing, treatment, and future vaccinations. Building back better means adopting a collaborative approach. one that ensures participation of those at risk of being left behind and relevant civil society actors when designing and implementing COVID-19 responses and socio-economic recovery measures. Data should also be disaggregated by sex, age, and disability status for groups where there is currently no reliable data, such as homeless persons, residents of informal settlements, and older persons. OHCHR is also concerned about the lack of healthy and safe working conditions for frontline medical workers involved in the COVID-19 response. 84% of confirmed COVID-19 cases amongst healthcare workers are women, which is close to the percentage of women working in the healthcare sector. Healthcare workers to whom OHCHR spoke raised concerns about fair remuneration for their jobs, as average salaries in the health sector were significantly below average salaries for less qualified work. They further complained about the inconsistent approach and discrimination in payment of COVID-19 related and other bonuses introduced by the government for healthcare staff. Only a small percentage of COVID-19 infections among healthcare workers were recognised as work-related, which negatively affected healthcare workers' right to social assistance and social insurance, for example, in the case of disability and death. OHCHR is further alarmed about cases of reprisals against whistleblowers amongst healthcare workers who publicly expose the poor preparedness of the healthcare sector. Conditions of work of all healthcare staff must be improved by ensuring equally for women and men decent pay, appropriate safety and health standards, and access to social security, including the recognition of COVID-19 as a work-related illness and the provision of adequate compensation. The report concludes with targeted recommendations to ensure that human rights are respected in the COVID-19 response and socio-economic recovery measures of the government and other actors. The recommendations include short-term measures, for example, allowing more freedom of movement across the EECPs in the east, in particular in the Donetsk region, and improving conditions of work for healthcare workers by establishing an effective dialogue between trade unions of healthcare workers and national and local authorities. These measures could be implemented immediately. There are also long-term measures to ensure we build back better, for example, increasing investments in the health and social protection sectors through progressive taxation and recalibration of the budget. The World Health Organization has warned that the situation of COVID-19 in Ukraine is likely to worsen before it gets better. Further measures are necessary to stop the spread of the virus. At the same time, the needs of the most vulnerable must be taken into account. While news of effective vaccines is encouraging, Ukraine will not only need to distribute the vaccine equitably, but will need to rebuild the economy, repair the damage done by the pandemic, and address gaps that it has exposed. As the High Commissioner for Human Rights pointed out, there is a different type of vaccine for these problems to address hunger, poverty, and inequality. The name of that vaccine is human rights. Placing human rights up front and centre provides a roadmap to ensure we leave no one behind and recover better to create a more resilient society. We stand ready to continue supporting the efforts of the authorities in this agenda. Thank you.
We had a question. Could you please give us more details how the pandemic of COVID-19 influenced the people in the east of Ukraine?
Was that a question? I'm not getting the...
It was under the live stream. Could you please tell us more how the COVID pandemic
influenced the people in the east of Ukraine?
Yeah, how it affected people on the east of Ukraine.
Oh, okay, thank you. Well, as I pointed out in my statement, one of the biggest impacts is on freedom of movement. And the longer the pandemic goes on, the more it's going to affect people in the East because they have such limited access to crossing the contact line. And we're particularly concerned that this affects people in the Donetsk area. The self-proclaimed Republic of Donetsk has put very severe restrictions in place in terms of crossing the contact line and is only allowing people to cross twice a week, very much limiting those who can cross. And as I mentioned before, this stops people from being able to see their families. It stops them accessing their pensions and other resources and other basic services such as healthcare. So the longer this goes on, the more desperate people are becoming.
Do you have any questions from the audience? Питання в залі? Будемо дякувати, завершувати.
Okay, then we'll say thank you to you. We are done. Thank you and see you later.
Thank you very much.
Thank you very much.